colleagues, ladies and gentlemen. Thank you for giving me this opportunity this afternoon to share with you some information about the cost of autism to individuals, families, and society. My role at Autism Speaks, Vice President of Scientific Affairs, is to oversee our investment in genetics, environmental sciences, and public health research, under which this particular study falls under. Autism Speaks recently announced preliminary results of new research that estimate autism costs society a staggering $137 billion per year in the United States, a number that has more than tripled since 2006. And annually in the UK has more than 34 billion pounds, equivalent to 54 billion US. This increase in total cost is partly due to more accurate measures of cost, more reliable data, the impact of care and residential placement for adults with autism, and most of all, increase in prevalence since the last study in 2006. The Autism Speaks funded research was conducted by Dr. Martin Knapp of London School of Economics and Dr. David Mendel of University of Pennsylvania. The World Health Organization, through its partnership with Autism Speaks, served in advisory capacity and provided technical support for the cost of autism analysis. Drs. Knapp and Mendel compiled information from recent studies of autism costs from multiple sources to calculate the cost of autism associated with current CDC-reported prevalence that 1 in 88 children are diagnosed with autism spectrum disorders in the United States. While the latest prevalence estimates in the US and UK are comparable, the primary difference in total cost of autism in the US and UK are due to differences in total country population. For instance, we have 5 times the population of the United Kingdom. For the rest of my remark, I will focus on US figure only. The research team found that the cost of autism in the US alone is greater than the entire gross domestic product of 141 countries around the world. In other words, fewer than 30% of the world's nations have GDP greater than that figure. They also found that autism severity is a major factor for cost. Autism severity, particularly intellectual disability, plays a major role on the cost of autism to individual, families, and society as a whole. The cost of autism per year are nearly twice as high on average for children and adults with intellectual disability than for children and adults without intellectual disability. For an astronomical $2.3 million for those individuals who are impacted by ID, compared to with more than 1.4 million for those who do not have intellectual disability. It is currently estimated that approximately 40% of individuals with ASD in the US have intellectual disabilities, defined as an IQ of 70 or less. It is important to note, experts consistently point to early intervention as key to increasing language and IQ scores, reducing lifespan costs. Total costs to the US were also based on adult prevalence of 0.5%. A very conservative estimate derived from past CDC study that's much lower than currently estimated autism prevalence of more than 1% in children. The researchers point out adult prevalence is an area where additional study and research in the US is much needed. The research found that non-medical costs account for the greatest proportion of expenses, while direct medical costs such as outpatient care, home care, and pharmacy contribute significantly to overall expenses. Non-medical costs, including intervention services, and special education, child daycare, and residential placement and care for adults who age out of school and can no longer live at home with parents, account for the larger proportion of autism costs. As confirmed by the study, the majority of costs related to autism are incurred during adulthood, principally due to the cost of residential care, as well as loss of productivity, underemployment, and unemployment among adults with autism. Put it simply, services for adults are both lacking and expensive. Based on this preliminary research, Autism Speaks recently provided additional funding to Drs. Knapp and Mendel to support an additional year of study to examine how autism therapies reduce lifetime costs associated with autism. Your investigation will focus on both intensive preschool behavioral interventions and vocational interventions that support individuals' independence during the transition to adulthood. Calculation will take into account costs related to healthcare, education, caregiving, housing, and employment. While the new research underway will give us a more refined understanding of early intervention's impact on overall costs, it is worth remembering that autism is a lifelong condition, and many individuals require support well beyond childhood. The challenge, therefore, is also about being smarter with how we invest in a good care system for individual and families living with autism. In other words, we're paying for the cost of inaction as well as inappropriate action. To quote Dr. Mandel, social exclusion of individual autism and intellectual disability and exclusion of higher functioning individuals from employment opportunities are increasing the burden not only for these individuals and their families, but society as a whole. Finally, as stunning the cost of autism is to society, the impact on families is immeasurable. We already know the burden of families affected by autism is enormous. The extraordinary costs further exacerbate that burden. Time and effort involved in coordinating the care and treatment plan across a large number of providers have reduced the ability of many families to earn a living. Too many families are still denied insurance coverage for essential treatments and services. And the economics add to overall emotional burden on families. The main reason, therefore, for developing an efficient and effective system of care for our family goes beyond health economics. It is the moral, ethical, and simply the right thing to do. There's immediate need for better coordination across public agencies and levels of government, from local to national, in ways that society structures service delivery system. Too often, responses to the needs of individual and family are piecemeal and less helpful than they should be. Let me be clear. With a prevalence of 1 in 88, the staggering costs to society, and more importantly, to individuals and families living with autism, the United States is experiencing an autism epidemic. This is a national emergency. We need a national strategy.